Hi there. Welcome to the Cranial Nerve Exam. I'm Dr. Adam, and today, as I said, we're going to be administering a cranial nerve exam to make sure you've got no anomalies and all your senses are working perfectly for you. If we can just get down some details about you and make sure that all our databases are up to date, so then that any correspondence we send you out, any sort of test results you may need at any point, they don't get mislaid and they get to you on time. Perfect. So, if I'm going to take your first name, please. Thank you. And then your last name or your surname. Perfect. And then if we can get your date of birth, please. Perfect. And then we also need your current address. So that's your address as well as your postcode or your zip code, depending on where you are located. Thank you. And then, last but not least, is there anything else? Obviously this is a cranial nerve exam today. If there is anything else that you need to bring up or would like to discuss or just get assessed while you're here, just let me know at the end and we can make sure we get that sorted for you. So you leave here with no worries at all. Perfect. Let me just make sure everything's definitely up to date in the system now for you. So I'm just going to put that down. And we're going to move on to our first area of the test. So this is a cranial nerve exam, and that will be testing all your major senses, all your major nerves. So it will be your sense of smell in your nose, and then it will be your eyes and your sight. And then it will be other bits and pieces like your reflexes and like what feelings you have. So like, is like your skin, can you feel like when I touch your skin and all your nerves firing correctly? And then it will just be a few other little bits at the end to make sure that you're in top shape. So we'll move on to our first area of the test, which is going to be your nose. So if you can just, first of all, close your mouth and breathe out of your nose for me, out of both nostrils, just like this. And then feel free to breathe out your mouth. You can breathe in your nose or out your nose, whichever you prefer. And then once you're done with that one, can you place a finger on one of your nose and close it? So you're breathing through one nostril and just breathe in. And out with your mouth. And then the same with the other side. So, in through your nose. And then out through your mouth. Did you have any difficulties with breathing out of either nostril, or you had one obscured? No, that's really good. That's usually a good check of like if your sinuses are firing well and things along those lines. So now we're going to move on to the first component of the test, which is your scent and your sense of smell. So I have 4 different scents for you to smell in these little cups, and if you can just let me know what you smell, and I'll let you know if you're right and how you're getting on. So this first one is a little bit light, so it's a bit of a subtler scent. So if you have issues smelling this one, don't worry too much. But it is a quite distinctive smell, so hopefully you'll be just fine. So, if you're ready. What do you smell there? That's vanilla. Perfect. That's going to be the sort of gentlest scent you'll have. The rest should be quite distinctive and quite easy to smell. So now for these last 3, can you place a finger on your right nostril or your left nostril and intermittently switch? So if you cover your left nostril for the first one, cover your right nostril for the second one, and then for the final one cover your left nostril again. Just trying to see if we can get enough smell in each nose to make sure that both nostrils are working correctly. So if you're ready, cover one side of your nose for me and we'll move on to this one. Coffee, really good. As I said, they are a little bit stronger, these ones, so they should be a bit more distinctive for you. Right, if you can switch your nostrils for me. And we go on to the third scent. What can you smell there? Peppermint, really good. So that's 3 for 3 so far. I'm going to move on to the final scent in here. So once again, if you can switch your finger over and block your nostril for me on the other side. And we get this one for you. It's the final scent that you can smell. Lemon, really good. As far as that goes, I can't see any issues with your sense of smell or your nose, as you've got all of those spot on and you didn't need any real coaching towards it. So we're going to move on to the next bit of the test, which is the eyes test, and making sure that your vision is okay. We're first going to test your colour blindness. So I've got 6 different pictures for you to look at, and can you let me know on the first 3 which numbers you can see, and then on the final 3, the last 3, it will be what shapes you can see. So what number can you see there? 12, really good. And how about now? A little bit harder. 16, that's really good. And the final numbers, 1 for you here. What can you see there? 74, perfect. Right, now we're moving on to a few shapes for you. Some of these may be a little bit more subtle, but let me know what 2 shapes you can see here, if you can see any. The shapes in this picture are a circle and then a cross. And to the next one. What can you see in this picture? A square and a circle. Really good. And finally, probably the easiest one for the shapes. What shape can you see there? A circle. Really good. That's perfect. I don't have any issues with any of your vision there. So we're going to move on again. Still testing your sight, but away from the screen and onto here. So I've got this pen. What colour can you see on the tip of the pen for me? Red. Perfect. Then just going to switch sides. If you can cover your left eye for me. What can you see here? Red. If you can cover the other eye for me. We're going to do it once more. Red. Perfect. And is that the same shade of red that you saw in the previous 2? Good. It hasn't changed, it's the same pen. But I just wanted to make sure that obviously you're not having any different colorations in your eyes, because sometimes that can be a cause for concern. So, that was really good. We're now going to move on to sort of testing your peripheral vision and bits and pieces. So I'll start out here with one of my fingers, and I'll just bring it in. And if you can see it waggling or wiggling, as soon as you notice it wiggling in your eye line, please let me know. And I'd like you to see it inside. And then you say yes, or you can just say or just give me a sign that you've seen it. So I'm going to start off with one finger. So if you're ready. Yep. Yep, really good. Perfect. Really good. Right, a little bit different now. Can you let me know once it's entered the screen? And then again once it's left the screen. Perfect. Perfect. Really good, well done. Well done. One more. Yeah. Really good, well done. Now, if you can cover one eye for me, we're gonna do 2 fingers at the same time coming in from different sides. And all I need to do is let me know when they've entered the screen. Don't worry about letting me know when they've left the screen this time. So, really good. Perfect. Well done. One more on that eye. Well done. So now if you can cover the other eye for me, we'll just go through that again to make sure that both eyes are symmetric and not having any difficulties adjusting. So, if you're ready, we'll go again. Yeah, well done. Perfect. Really good. Well done. One final one for me. Well done, that's really good. I can't really see any issues with that one at all there. So, I think we're going to move on to the light test. So, if it's okay with you, I'm just going to check your eyes. So I'm just going to move my way in. And just so you can see the torch, if you can just look at my nose for me, and then keep both eyes open for now. And I'm just going to check your eyes for you. If you now don't mind just covering one eye for me, and I'll just make sure I'm checking your eyes for you. Thank you. And now if you can cover the other eye for me, I'll check that one. Really good. Right, if you now can, just focus on my nose for me. And I just want to see the reaction from the torch coming in from your peripherals on each side. So the torch will enter from here. And I just need you to keep looking up directly at my nose for me. Okay. Remember, stare on my nose, on my nose, look at my nose. Look at my nose, look at my nose. Perfect. Carry on, go on, carry on looking at my nose, look at my nose, look at my nose. My nose, look at my nose, look at my nose. Perfect, thank you. A couple more times. Just make sure you're staring right here, right on my nose. Really good. Final one. Keep staring right here for me. Just gonna... Perfect. If you can now see the objects behind me here, see the corner of this picture frame, if you can focus on that for me. And I'm just going to shine the light. Have a look. So now can you look left for me? And can you look right? Look up. And look down. Perfect. And then, if you can still focus on that for me. And cover one eye for me. So, that was both eyes then, if you cover this eye for me. And then focus on the objects in the background. So you can either focus on top of this corner up here, or you can focus on this corner of this frame here, and I'm just going to check your vision. So again, if you can look left for me, look up, look right, and look down, and then switch over to the other eye, so cover the other eye for me, and look either here or up here, and same again, you can look up, look right, look left, and look down. Perfect. I don't see any issues with your sight at all in that one, so I'm just going to put my pen down, and for now we're going to still do some focusing but without the lights, so your eyes can have a little bit more of a rest. So all I need you to do is cover one of your eyes for me again. So whatever eye you don't cover now, we'll cover in a minute. So don't worry about being too picky with which eye you're covering. And all I need you to do is follow my finger around. So just make sure you're following it. Just make sure you're tracking it. Really good. Just focus on my nose for me quickly. Perfect. And now if you can focus on my nose and follow the finger without moving your head, that would be perfect. Really good. And now if you just uncover that eye you're covering and cover up the other eye. And the same again, focus on my nose and just follow the finger using only your eyes. We don't need the head movement, just the eyes. Really good, keep it up. Just make sure you're following it. Perfect. Really, really good. And now, if we uncover both eyes and do the same, make sure you're focusing both on my nose and just follow the finger wherever it goes around the screen, whether it's forwards, backwards, or around. Just make sure you're keeping an eye on it for me. Perfect. That's really good. And finally, for your eye tests, all I need you to do now, that's okay with you, I'm just going to bring my finger close to your eyes, and I just need to see how you react. So I'm not going to poke your eyes, I'm not going to poke anywhere in your eyes. Just let my finger get as close to it can to your eyes, and I just want to see how it reacts without me really touching you. Okay, if you're ready, we'll start. Really good. Now the other eye. Perfect, that's really good. So that's going to be all for the eye test. We're now going to move on to the more reflexy sensory bits of the test. So I've got a sharp and a dull object. And don't worry, this pen is out of ink. So the sharp object is the end of this pen. And it is out of ink, so it's not going to leave any marks on you. And all it's going to be, if you can put your hand out for me, like this. And it's just going to be a little tap. And just let me know when you feel it touch your skin. And that's going to be on your face here. So you can keep your eyes open or you can close them. But all I need to do is let you know when I've touched you. So, really good. Perfect. Thank you. Yeah, really good. Well done. Perfect. And the final one. Really good. So, with that premise, we're going to move on to the same thing, but I've got a little pointer here. And this is a lot duller than the pen. So if you put your hand out again, I can just let you know how it feels. And I'll just poke that in your face and just let me know So be like, just let me know when it touches you. And when you feel the finger touch your skin. Okay? Right. Very good. Perfect. Really good. Well done. Couple more. Well done. And the final one for you. Really good, well done. Now that we're done with the sharp and soft bit of the test, or the dull bit of the test, we're now going to move on to some face movements to make sure that your face is functioning properly. So, the first thing I need from you is if you can just bite down 3 times. So, just some nice slow bites to make sure that your jaw is functioning. Perfect. And then all I need you to do is swing your jaw side to side. So you're not grinding your teeth, you're just moving that jaw side to side, making sure that it's swinging. Really good. Now, if you can open your jaw and show your teeth for me. I'm just gonna sounds really good. So, next, if you can raise your eyebrows as high as they can possibly go. So, raise them as high and as high as you can possibly get them. Perfect. Now, I need you to close your eyes. And then once they're closed and you feel comfortable, close them even tighter. So you're almost like scrunching your eyes up. I just want to see how much force you have in your eyes. Really good. And if you do that once more for me. So, close your eyes just as normal. And then close them tighter. And then the final 2 things I need you to do for me is just show your teeth. So just make them nice and visible for me. And just make sure everything's lining up and you all look fine. Really good. Finally, I just need you to puff your cheeks up. So as much air as you can get in your cheeks. So it's really trying to force the air out, but also really trying to keep it in. Perfect. Thank you very much. So that should be the movement bits over for you. I'm now going to test a bit of your hearing. So I'm going to make a noise in one of your ears, and then I'm going to say a word, and all I need you to do is tell me what that word is. So it'll be something like that. And then all I need you to do is tell me what the word is. I whisper, and I'm going to cover my mouth so you can't read my lips, because that's obviously going to help you. This is about your hearing. So, cat. What was that? Really good. And then the other ear. Dog. Really good. And the final one for you. Cucumber. Really good. I'm now going to step behind you, so don't worry. And you can either close your eyes. You don't have to close your eyes. But I've got a noise here that's going to sound like this. And all I need you to do is tell me what side of your body it's on by either raising your hand of the side it's on, so like that, or just telling me left or right. And I'd also like you to tell me when you can't hear the sound anymore, when the sound has stopped. So I was going to step round out of the way, and I just need you to let me know when the sound stops and what side it's on. Perfect. Really well done. Perfect. And one more. Well done. Perfect. Right. So, we've only really got one more thing for you here. And I'm going to get the torch out again. So, if you can open up your mouth for me and just say, ah, and I'm just going to have a look inside your mouth. So, when you're ready. Thank you. Let's keep that ah going for me. Thank you. And one more thing I need you to do for me. We've got as in front of you there will be a little cup of water. So if you can just take a swallow of that for me. Good. And did you have any issues swallowing? Did you feel anything that didn't feel normal? Or was everything feel normal? Did it go down perfect? Really good. And another question for you regarding that. Do you have a cough or have any issues after you eat or drink? No, I think that's just something I need to check, but really good. So, the final thing is for you now. Let me just put my pen torch down. I'm going to put my hands on your shoulders like this. And I just need you to push up, and I'm going to push down. So you've got to resist what I'm pushing down. So if you're ready. Perfect. And then all I need you to do is I'm going to put my hand like this on the other side of your face. And I need you to push into my hand. And I'm going to push your face away. And I need you to resist that. Okay? So, if I push in, can you just resist? Pretty good. Now the other side for me. Here. So just resist my hand. Really good. So, that is the end of your cranial nerve exam. I couldn't see any anomalies or anything wrong with it, any of the tests you did. So, as things go, you are perfectly healthy. Before we wrap this up, is there anything else that you'd like to bring to my attention that you're worried about, or that you'd like advice on, or you'd like checked over? No, brilliant. That's really good. Well, if you ever do need anything, we're always here. We're a phone call away, or we are available to contact online if you don't like phoning, or if you don't have time to phone. But yeah, we're always here if you need us. If anything you need checking up at all, just let us know, and we'll book you in for an appointment. But if that is everything, we can book you in for your next cranial nerve exam. Either 6 months or a year away, depending on which you'd prefer, if you'd like. Or you can just book it in at a later date, either through the phone or again through the online portal. No, that's fine at all. We don't need to book it in today. So we'll let you go. But thank you for using your time to come in today, and really good that everything's all good. So I will see you for your next exam in 6 months to a year, and I hope you have a nice day.